Pathological addictions. Addiction is a chronic disease. Main addictions are drug addiction, addiction to psychoactive drugs and prescription medicine; alcoholism, which leads to serious physical damages, for example liver, brain and other organs, and psychological consequences, aggression and depression; compulsive gambling, addiction to gambling. People with addiction to drugs spend a high amount of time trying to obtain and using substances and wearing off the effects without worrying about physical and social damages caused by this behavior. This negatively affects their relationship, work, life, and health. Addiction leads the body to get used to the substance, hence the need for increasing amounts to achieve the desired effect, and then to withdraw, which manifests with physical symptoms when substance use is suspended or reduced. Psychological symptoms include overwhelming urge of substance, sadness, sense of guilt, anxiety, denial and shame, low self-esteem, depression, loneliness, and anger. To treat addiction, residents with an assigned general practitioner can directly access the local SIRDP, Service for Addiction. For those who don't have residents, access to this service is mediated by Unità di Strada, a street unit that accompanies patients to the SRDP and ensures they are admitted. The use of the service does not imply that personal information is shared with law enforcement office. In the privacy form, the person can choose who can be informed about their treatment. Also, professionals providing the service are subject to professional secrecy. Treating an addictive behavior reduces the risk of criminal wrongdoing. Treatment does not impair the patient's ability to work and engage in daily activities.